So this is a little trick. The device, it is a little bulkier than your standard endoscope. It's probably even a little wider than the variceal banding. This is kind of a little trick that I've kind of do on occasion. I think this was actually a bleeding case. I can't remember if it was that one or another one, where I could not get it past. Sometimes you have that redundant tissue at the level of the vocal cords as you're trying to traverse, and you can't really get through, or maybe there's a little GE junction stricture and you're trying to get across it. So what I'll do is I'll actually usually grab a 10 to 12 millimeter balloon, because the inside of that cap is about 10 millimeters. And what I'll do is I'll put the little guide wire down. I'll put the padlock on, which nice about it is, we talked about earlier, that channel's open. And I will take, that 10, 11, 12 millimeter balloon, not necessarily for dilation, but this is the area I could not get the padlock through. So I put the little guide wire down into the esophagus. I inflate the balloon below the padlock like that. And then I kind of pull it up into the padlock with a little bit of tension to where it almost gets to where it's one continuous unit. And I keep a little back tension on the balloon. And as I do, I advance the scope and it'll follow the balloon. And so you'll see I advance right here. I get about, just a centimeter or two down. I got past the area that I could not get out, pull the balloon out, and now I'm into the esophagus, which I could not get to previously. Just be careful with that. I do like to pass the little wire that comes with the balloon dilator down the esophagus a little bit, because I really don't want to advance that balloon because it has a little firm tip. Just out of fear that it would go into the esophageal wall. That's just a little trick that I do sometimes, particularly if it's something that I need this device to get down. But just be cautious, but that's a little trick that I use sometimes just to get through little narrowings in the esophagus, or particularly GE junction or upper esophageal near the cords, where you can get some of that redundant tissue, which does have a tendency to maybe catch on that cap.